Respected dignitaries on the dais and of the dais. Title of my paper is Issues and Challenges Related to Environmental Hygiene in Ahmedabad City. As we know that India's urban hygiene situation is facing several issues. My study is about India's most important metropolis, that is Ahmedabad. While discussing about metropolitans, we must discuss about the issues of Ahmedabad city. Nearly 60 million people in metropolitan areas do not have access to adequate sanitation, and more than two-thirds of wastewater is discharged into the environment untreated, damaging land and water bodies. To solve this environmental and public health concern, urban India will need to handle the entire sanitation cycle, which includes universal access to toilet as well as safe collection, transportation and treatment of human excreta. In fact, while discussing about issues and challenges faced by Ahmedabad as a metropolis in India, it has been found that there is lack of public awareness regarding water and sanitation. Even air quality index is 156. That seems very poor. This paper investigated environmental hygiene in Ahmedabad as an urban metropolis. My paper noted Ahmedabad poor hygiene and challenges and highlighted the issues that have contributed to the city's poor hygiene as poor town planning implementation, incorrect waste management and disposal, inadequate sanitation, overcrowding, and poor ventilation. These circumstances have a major negative influence on the health of city people. My paper also proposed the ways for enhancing the city's environmental cleanliness, healthy living, and long term urban growth and development. This study has investigated the causes of inadequate cleanliness in the Ahmedabad urban environment and its impact on the health of the city people. It has also provided methods for improving the city environment for long-term human settlement and growth. For this study, total 486 households were observed with the residents' consent. So this is one kind of the study of primary data sources. We will not discuss more about the data because it is already published in the book. So I will directly go through some strategies for improving environmental hygiene in Ahmedabad city. So as well as some other metropolitan cities, to ensure that aesthetic qualities and beauty are created in our metropolitan cities, the environment's architecture can meet some of the psychological demands of individuals in a society. Visual delights soothe a troubled heart and promote lifespan. Landscape design is a great tool for creating a pleasant atmosphere. Second one is, as a result, urban development should strive to provide for aesthetics and beautification, particularly through the provision of high quality open areas to accompany such growth. To create such beautiful environment and community via an international search for beauty supported by people's vivid awareness of the visual world. As a result, aesthetics and visual art are taught in our schools, beginning in our primary schools, to make certain that we encourage successful urban and rural development programs through the provision of basic amenities, services, and infrastructure, as well as small scale industries also. To ensure that the facilities necessary for good disposal systems are available, one more thing that Ahmedabad Municipal Corporation broad distribution of garbage bins is a good initiative for that. So I will go directly through the conclusion. The aforementioned action are required if we are to have a harmonious, appealing, and aesthetically acceptable environment free of health dangers. It is expected that if these guidelines are followed, our cities would flourish in an environmental friendly manner. Furthermore, uncontrolled development will be controlled and avoided. These methods can prevent un- untimely deaths and increase the life expectancy and hygiene condition of the ordinary Ahmedabad city. Thank you. And at last, I am very much thankful to Professor Dr. Bindeshwar Pathak sir, Neil Ratan sir, and Vaghela sir to give me an opportunity. Thank you so much.